Hi, good afternoon everyone. This is Dr. Sarkar. I am the second year psychiatry fellow in Child and Adolescent at Texas Tech University Health Science. We are in Permian Basin. Our address is Psychiatry Outpatient Clinic 2301 West Michigan Avenue. Our phone number is 432-620-1160. Today we will discuss one of the very most common mental health issues in our society. We call social anxiety disorder or social phobia. This is one of the most common mental health condition affecting a significant portion of the population. Persistent intense fear or anxiety in social situation where scrutiny is possible by others, fear of negative evaluation, and avoidance or endurance of this situation with significant distress or impairment. In USA, around 7.3% of adults experience social anxiety disorder in a given 1 year period. In national mental health data showed we have 12.1% of population has the social anxiety disorder in their lifetime. A person diagnosed with social anxiety disorder must persistent intense fear or anxiety about social situation because you believe you may be judged negatively, embarrassed, or humiliated. Avoidance of anxiety producing social situation or enduring them in intense fear or anxiety, excessive anxiety that's out of proportion of the situation. Anxiety or distress that interferes with your daily living. Fear or anxiety that is not better explained by a medical condition, medication, or substance abuse. Social anxiety can take different forms like generalized social anxiety disorder, non-generalized social anxiety disorder, or specific social phobias. When to get help for social anxiety? It's a good idea to see your primary care physician if you think you have social anxiety, especially it is having a big impact on your life. Your PCP will evaluate your symptoms and mental health conditions will determine you have anxiety disorder or not, will offer you the management accordingly. PCP will start some behavioral intervention. You try to understand or more about your anxiety by thinking about or writing down what goes through your mind and how you behave in certain social situation. It can help you to keep a diary. Try some relaxation techniques such as breathing exercise for stress. Break down challenging situation in smaller parts and work on feeling more relaxed with each part. Try to focus on what people are saying rather than just assuming the worst. If all intervention do not help, if primary care physician think you could be have social anxiety disorder very severe, you will be referred to a mental health specialist to have full assessment and talked about the treatment. Social anxiety disorder can be chronic mental health condition, but learning coping skills in psychotherapy and taking medication can help you to gain confidence and improve your ability to interact with others. Treatment depends on how much social anxiety disorder affects your ability to function in daily life. The most common treatment for social anxiety disorder includes psychotherapy. We call also psychosocial counseling and or talk therapy. Sometimes we also add medication or we do both. Psychotherapy improves symptoms of most people with social anxiety disorder. In therapy, you learn how to recognize and change negative thoughts about yourself and develop skills to help you gain confidence in social situation. Cognitive behavioral therapy, we call CBT, is the most effective type of therapy for anxiety, and it can be equally effective in individually or in groups. In exposure-based cognitive behavioral therapy, you gradually work up to facing the situation you fear the most. This can improve your coping skills and help you to develop the confidence to deal with anxiety-inducing situation. You may also participate in skills training or role playing to practice your social skills and gain comfort and confidence relating to your others. Practicing exposure to social situation is particularly helpful to change your worries. Medication, if your psychotherapy does not help, with the psychiatrist or the primary care physician sometimes give selective serotonin reuptake inhibitor, we call the SSRIs. Two of the most common popular medication we prescribe, one is paroxetine called Paxil, and other one is sertraline, we call Zoloft. And we also use another serotonin norepinephrine reuptake inhibitor, we call SNRIs. The popular medication is venlafaxine, also commercial name is Effexor. It may also help to control your anxiety disorder. Other medications, sometimes other providers, they prescribe other anti-depression medication, and there is one of the popular medication that we mostly use for anti-anxiety medication is called the benzodiazepine. Benzodiazepine, very rapid in action, helps to reduce your anxiety quickly, but the problem with the benzodiazepine, it makes you sedating and you could have addiction. That's why we sometimes prescribe benzodiazepine, but it's only for short-term use. And another popular medication we also prescribe to control your social anxiety disorder, we call the beta blocker. Beta blocker works by blocking the stimulating effect of epinephrine, we call the norepinephrine, and this medication also lower your heart rate, decrease your blood pressure, reduce your heart pounding, and reduce your shaking voice and limbs. A lot of political leaders or people, those who have social anxiety disorder, speaking in front of the people, they use this medication. That's why this propranolol medication is very popular to us. But this beta blocker is not recommended for general treatment of social anxiety disorder. Conclusion again, while social anxiety disorder is a chronic condition, can be scary, but the good news is it's manageable and treatable. Your mental health is just as important as your physical health. So be sure to talk with your primary care physician or your healthcare provider about what you are experiencing. With the right support and tools, it is possible to significantly reduce symptoms and improve quality of life. While it may not completely disappear to everyone, effective treatment can lead to a point where it no longer significantly interferes your daily life. The sooner you get help and the treatment, the sooner you will feel better. Again, this is Dr. Sarkar. I am the psychiatric fellow working in the Midland Memorial Hospital Outpatient Psychiatric Clinic. We are located on South Psychiatric Outpatient Clinic, 2301 West Michigan Avenue, Midland, 79701. Our phone number is 432-620-1160. If you have any problem, any issues with you or your someone known that your family member has the problem, bring it to us. We are here to help you, and thank you all. Hope to see you again with another topics.